When it comes to sports and chiropractic, there's two types of occasions where an athlete might want chiropractic care. One is the acute injury. Maybe they were doing CrossFit and hurt themselves, or playing a ball sport or a field sport, and they want me to treat that. The other is an athlete trying to get a competitive edge, or they're trying to prevent future injuries. First, we'll talk about the acute injury. Maybe they were on the football field and maybe their knee went into slight hyperextension, or they have a chronic issue, a tendinosis, or maybe something that's just happened, tendinitis, and they want me to treat it. Each of these issues are separate. The idea with the knee is to make sure, hey, is the ACL, the structures intrinsically of the knee that keep it together, is the ACL, PCL, lateral, medial, collateral ligaments, are all those stable? If they're stable, then I can move on to other things to find out what's going on with it. And if it's an inflammation issue, maybe we can approach it that way or co-manage it with their PCP or an orthopedic. But if it's let's say here recently a patient came in with tendinosis of their Achilles. They've had it for 15 years, so you have to kind of treat the whole fascial link. The hamstring, the calf, making sure the ankle moves, making sure the back is moving, making sure the hips are moving. Everything within that area has to be kind of corrected. Or it's tendinitis, something that just happened yesterday. You have to treat that differently. Ultrasound, ice, light stretching, negative stretches, isometric stretches. You kind of have to make sure you know what you're treating before you kind of get into it. And then you have the athlete trying to get a competitive edge. That athlete wants to know, what can you do to make me better? This is the reason why you have all these major athletes, Tiger Woods, the Green Bay Packers quarterback. All these athletes use chiropractic as a competitive edge. They want to make sure their joints are moving the right way. They want to make sure the muscles are contracting, they're lengthening in the right way. They want to make sure that they have all the competitive approaches to getting better. And chiropractic can definitely do that, especially with golfing and things of that sort. And then you have the patient that just wants to make sure they're not going to get injured. They want me to make sure that the joints are moving like they should, so they're not getting compressed and they're having degenerative processes that's happening in the neck, shoulder specifically with CrossFitters, or they have tennis elbow, golfer's elbow, or their wrist is hurting because they're putting the weight on there. Those are things that chiropractic, that's what it was born to do. It is that opportunity to where you can make sure that you are not going to create those issues in the future. Chiropractors went to school for 8 years to know what they know. The idea, because there's an injury where, hey, the muscles are kind of rebuilding, or did you actually hurt the muscle? So those are two separate things. And did you tear the muscle? Did you irritate the joint? You have to kind of have the science behind it. You have to have the knowledge. Did you really injure something, or is this growing pains when it comes to being an athlete? So one, making sure it's an injury. If it is, how do I treat that and move on? Versus, okay, how do I make sure that it's not an injury, so what do I do to kind of make sure that this doesn't happen again? And someone that's worked out for a few years will know the difference between growing pains, as we call it, or an acute injury. But if you're in the beginning stages of this, you kind of can't catch it. But it's the knowledge. It's having a doctor kind of saying, okay, this is what it is, this is how you treat it, or go home, do some stretches, run it out, you'll be fine. Athletes and children are two areas that I love, because children respond so quickly and to the treatment. Athletes respond quickly also. They're hungry to get back on the field. They're hungry to return back to their athletic nature, so I don't have to be super aggressive with getting them to do their exercises. They just do them because they want to get back on the field. So athletes are fun for me, mostly because they kind of follow through with treatment, but also they respond very quickly. So I personally enjoy working with athletes.